Unbelievable things.
Exceptionally at the forefront.
Largest source of development finance for low-income countries.
Forefront of the global fight against poverty.
Joining forces.
Supports localization.
Access to affordable financing.
IDA.
IDA's.
Schools, nutrition programs, unbelievable things. The main thing the World Bank does that really improves the human condition is a concessional finance arm called IDA, International Development Association. That is funding primary health care, schools, nutrition programs, unbelievable things.
The World Bank and IDA have been exceptionally at the forefront, emphasizing supporting host governments to include refugees in national systems. This has been done through real, meaningful, tangible action, backed by significant financial resources, and specifically the $3.8 billion that have been made available to 17 refugee hosting countries around the world.
The International Development Association remains at the forefront of the global fight against poverty. Indeed, ancient wisdom tells us that if you want to go far, go together. MDBs are gearing up to scale up co-financing significantly. The Islamic Development Bank and the World Bank decided to walk the talk last month by announcing a co-financing envelope worth $6 billion through the year 2026.
In today's complex and overlapping crises, IDA is an increasingly important source of sustainable financing to help ensure that the most vulnerable are not forgotten amid climate disasters, conflict, and public health emergencies. UNICEF looks forward to continuing our work with IDA to create a better, brighter future for the world's children.
Responding to human suffering requires long-term vision and planning, as well as presence and experience on the ground. Joining forces, the ICRC and the World Bank improve their capacity to alleviate suffering of the people, increase the resilience of communities in conflict situations.
Since the beginning of Yemen's war, IDA has supported the Social Fund for Development in protecting millions of Yemenis from famine, whilst creating tens of thousands of sustainable jobs. The way in which this has been achieved is important because it supports localization. That means it believes in Yemenis and supports national capacity.
The World Bank and the IDA resources back a country's national development strategies. They don't just focus on a single issue, and this is incredibly important to make sure that we get results that work for all citizens of countries. The second reason is a crisis response window and the support that IDA can provide to countries before crises hit to prevent crises, but also to scale up funds when crises do hit.
Access to affordable financing is key to making any renewable energy project a success. In a fragile country like Somalia, working with MIGA, with backing from IDA's private sector window, has therefore been a key to securing investment.
WHO's partnership with IDA has grown significantly in recent years and has allowed us to expand our work with countries to address critical problems in the most challenging environments. With IDA support, we have strengthened health systems in the Democratic Republic of Congo, supported the development of primary care in Nigeria, expanded access to health services for vulnerable groups in South Sudan, and addressed the links between health and climate in small island developing states.
A heartfelt thank you from myself and my colleagues at the Social Fund for Development to IDA and all those supporting IDA.